Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you with the Common Sense MD podcast in Bristol today with Jill Henritze, who's PA extraordinaire for many years, the first 20 years being orthopedics. So she's an expert in orthopedics. Now she's an expert in everything integrative medicine-wise that we do here at PM. But I wanted to get her back on here today to talk about a couple things, and mainly cortisone injections of joints when you need them, what they do, precautions, etc. But the reason I'm using this prop, which is a pickleball paddle, as a matter of fact, it's mine. It's a Jula. I love the Ben Johns model. As you can see, I play a lot of pickleball, which comes with its orthopedic problems.
For sure.
Pickleball.
Especially knees.
I know, especially knees and, yeah, right, like mine. But in any event, you've done some PRP injections to both my knees, and it's really helped me a lot. But we're really going to focus on cortisone injections today. But in any event, I love pickleball. It's the fastest growing sport in the United States. It's not going away. It's fun. It's social. It's mostly older people like me that when you hit the ball, it makes you feel like you're playing really good tennis again when you really cannot play good tennis again. So, but there are a lot of injuries in pickleball, and I think it may be because, number one, you have an older population playing, and they're not warmed up. They just get out there and play,
Right.
and they're moving. It's not a strenuous sport by any means. It's mostly doubles, but most of these people are older. They're not warmed up or loosened up, and they're making these quick movements side to side.
Right.
So we see a lot of injuries. I've seen some against people I've played with, like ruptured Achilles. One guy, I was right beside him on the court. He ruptured his bicep playing pickleball.
Oh, goodness.
I was right there. But anyway, so you get a lot of injuries. And, number one, you want to prevent injuries by loosening up properly and, maybe at a certain age, not going after some of the balls that you would go after as a 20-year-old. That's what I found. But anyway, I love pickleball. It's fun, but you have to be careful that you don't end up injuring yourself. Today, I'm going to talk about, or Jill's going to really talk about, when you should get a cortisone injection in a joint. We've done them for many years. You've done tons of them. Tell me about cortisone injections. When should you think about getting one? Because they're like magic.
Yeah, they really can be. It depends, of course, on the injury, how long ago, was the injury as to the timing of the shot, let's say. But especially if you have known arthritis in your knee and the increased activity is causing some pain, that's a good time to get a cortisone shot. And it can work quite well. It can work for, several months even, and calming down the pain. If it's a new injury, let's say you didn't have pain prior to playing pickleball, but then, like you said, that sudden cutting and that jumping and moving can create a knee problem. Depending on the severity of it, how long it's been going on, if it's a new injury and we have a lot of swelling and we have something we might consider to be, let's say, a meniscal injury, that might be something that would require some more investigation first.
Right.
To determine, do you or do you not have any arthritis change in the knee in addition to that? Sometimes still conservative treatment is a good option, and eventually doing a cortisone injection, even with a meniscus injury, can help, especially if you already have a little bit of wear and tear in the knee, which with the population of people we're talking about, may happen. And so cortisone injections can help with that. If you have, of course, a younger patient that really doesn't have any wear and tear in the knee or any degenerative arthritis, sometimes still a cortisone injection is warranted. If we've been treating something conservatively and it's not improving, or we feel like it's, let's say, a chronic tendonitis, or sometimes even a patellofemoral syndrome or placa syndrome, or things that's more common for a younger patient, a steroid shot can be helpful. And sometimes it can actually cure the problem, with proper rest and some rehab. You wouldn't want to repetitively inject a healthy joint just because over time it can soften cartilage and that kind of thing. But if you've got some arthritis in there already, it's one of those things is some of the damage is happening. You just have to be smart about it, not get it too frequent, and realize how much benefit you're getting over the risk.
So how often, say you have a lot of chronic knee problems, you're not ready for knee replacement or any kind of surgery, how many times per year do you feel comfortable injecting steroids in a knee?
I think in definitely no more frequent than every 3 months. And if you, of course, if you're a diabetic patient or you have other issues where we wouldn't want to use steroids because we're causing other side effects, maybe less frequent than that. But that would probably be the maximum amount.
Interesting. So maybe up to 4 times a year
Yes.
in any one particular joint. It's funny because when I've had it done to my knee, everything gets better for a while.
Oh,
Even my back. I mean, so it does have some systemic effects.
It does.
But it's mostly going to be in that joint. You know, we use cortisone or steroid shots for a lot of different things. It's part of our sinus shot. If somebody comes in with any kind of terrible inflammatory reaction, whether it be hives or rashes, or we even do it sometimes for migraine headaches, anything inflammatory in nature, it tends to help. But again, it's more like a usually temporary thing to calm it down. Now, there's different kinds of steroids. Which kind do you prefer in a joint?
I usually like to use either Kenalog or Depomedrol in a joint, or even let's say we're injecting it like a tennis elbow or at a golfer's elbow, shoulder injection. So I typically here, definitely at PM, I use Kenalog. And the amount will depend on the size of the joint. You know, if we're injecting a really small joint around the hand or wrist, I'm going to use, a much smaller amount than I'm going to use in a knee or hip or shoulder. Mm-hmm.
So you inject most joints? Are there any joints that you don't want to inject? Spines?
Right. Yeah, no, I wouldn't do any spines. I wouldn't do, but otherwise, I mean, I would inject about
on time for sure.
Yeah, thumb, wrist. I mean, I've injected areas in the midfoot. People get midfoot arthritis or great toe arthritis is common. You want to be careful about some tendon injections. Like, obviously, you shouldn't be injecting around the Achilles, or even plantar fascia is frowned upon a lot because you can get some injury there without ruptures. And you will find some differing opinions on that. And then even, injecting around a bicep tendon insertion, which is very common because bicep tendonitis is common. You just need to know the risk. You need to, the patient needs to know that I need to rest that bicep tendon for several days afterwards to let that, because it does weaken the tendon insertion a little bit.
Yeah.
And so your risk of that long head bicep coming off is much higher, which is a common injury as you get older, unfortunately.
It is. I've seen a lot of ruptured biceps.
Yeah.
One of the main places I've used it clinically in my practice is elbow, tennis elbow.
Oh, for sure.
I mean, it works really well for that. You'd be amazed at how many people go months and months and months with a terrible case of tendonitis. They should have gotten a 3-second injection in there that would have cured it most of the time.
Yeah, it really can work well for tennis elbow and a golfer's elbow. Sometimes those become chronic, and you inject it and it's back. It depends on the activity level, right? How much you're playing. But if it comes back, and certainly it's one that you can repeat inject. But then it comes down to, with something like that, if we've injected it, with 3 or 4 times and it just keeps reoccurring, then you might say, okay, maybe we need to think about a surgical option or make sure, or PRP.
Yeah.
That's sometimes too in a tennis elbow or something. A lot of times if there's not a reason not to do steroid, I would say start with that first. Because like you said, sometimes it can cure the problem.
Yeah.
Sometimes if it becomes recurrent and you tried a few times and it's recurrent, it's not getting better, then PRP would be a good option because it's going to work in a different way for that particular injury.
And I find it can be almost diagnostic too, because if you get a cortisone injection and a week or two later it comes right back, you need a PRP injection.
Yeah.
Because it's going to work, but it's just not going to last that long in a particular joint.
Right.
So any other precautions? It's very safe. Of course, anytime you stick a needle anywhere, you can get infected.
Right.
You use sterile procedure, of course. Now, do you add a little Marcaine or lidocaine with it to
I do.
kind of, so the cortisone kicks in? How long does it usually take before you're better? 12 hours, 24 hours?
I think it depends on where you're injecting. I feel like sometimes, it can get worse before it gets better. That sometimes can happen. Especially I feel like the tennis elbow or the golfer's elbow or something like that. We're going to sometimes see more pain before we see the improvement. Not always. For a larger joint, I feel like sometimes, within 24 hours, you can start to feel some improvement. I always tell everybody, give it at least 3 days before we say it didn't work, because sometimes it will start to improve and it will continue over that course of time and even continue to improve up to 6 weeks. And then I feel like it definitely plateaus. But usually you'll see improvement within that time frame. Sometimes you can get a post-injection flare. I don't know if you've had your patients do that over the years, but yeah. And so the steroid can go in the knee, and even though it's helping with inflammation in the beginning, it just creates more inflammation. Now, almost like that crystallization of the steroid can irritate the tissue. And it typically wears off and gets better, but that can happen. Not as common, but it can happen.
If that happens, should you ice it down?
Yes. I usually recommend, rest for sure, and icing, and time. And you could take some anti-inflammatories if it was a bother. Yeah. Yeah.
Okay.
But I do mix lidocaine in it with everything. You mentioned that a minute ago. And the lidocaine, of course, will work right away. That's another thing, thinking about diagnostic.
Yeah.
Sometimes if you're not sure of an injury, you might even just use lidocaine in an area, and if it gets better and they can perform the exam better, then that's the right spot. Then you might go back and put a steroid as well.
Do you ever do trigger point injections at different places like scapular areas and you find that to be curative or diagnostic? Or
I would say both. Yeah, but trigger point injections around the traps and into the rhomboids, around the border of the scapula. There's a little scapulothoracic bursa there that sometimes will get inflamed. Even trigger point injections down low for low back pain can be helpful.
Mm-hmm.
I find those can be sometimes curative, but definitely diagnostic.
And one time I'll tell you,
pull in or out.
Interesting is I have a lot of back spasm, especially on one side. I've got scoliosis and it really pulls to one side. And one time I had one of the nurses put Botox in my back, and it really did loosen it up. Mm-hmm. You have to put quite a bit in there.
Right.
But have you ever done that on a patient?
I have not done it for spasm, but definitely I've read a lot about it. Doing it, of course, they do it for migraines and headaches, but doing it around the neck and shoulders for cervicalgia and spasm and the low back. Yeah, there's definitely some trying that.
Look a lot younger too.
That's so. Yeah. It probably did taste like a bit of medication though. Because even you think about, we do it in the TMJ, it takes
that's right.
a lot of units to get a result.
And in migraines, I use a ton.
Yeah. I've never injected for that, but
I've done it a couple times. You have to inject all the way around it, in the circle. You could use up to 200 units. It'd be very expensive unless your insurance covered it for that reason. But, so after a steroid shot in a joint, you should stay off. Don't do anything strenuous like pickleball or hiking for a week.
Yeah. If we're treating, let's say, a person that we know has pretty significant arthritis in the knee, obviously that's a chronic issue. So I would say take it easy for a few days, probably 3 to 5 days. If the knee feels better, you can probably just go with how you feel on that and slowly bring your activity back. If we're treating a knee that's that we feel like is more of an injured knee, or a tendonitis, a soft tissue injury, then I would have you rest it a little bit longer, because we're hoping that's going to really be more of a curative fix. For that kind of injury, I would say wait on pickleball probably for at least a week, maybe 2, and then slowly start to add those things back, especially if you think about runners, long distance running, you might hold off on a little bit more. If you were doing a heavy weightlifting and stuff, you might be careful with deep squatting, lunging, things that are straight. Just think about the knee, particularly things that are straining the joint.
Awesome. You're amazing. You really are. Any other words of wisdom for us pickleball players, orthopedic wise?
I think what you said earlier was a good point. Make sure to loosen up a little bit before you just jump right into the game. And that can be, walking around the perimeter, getting warmed up before you even stretch.
Dynamic stretching, not static.
Right.
Is that what you recommend?
I do. Yes. And then, being smart with your activity. Try not to reach for those balls that might just be a little bit out of bounds or for you to risk an injury.
So you should just call it out of bounds. So just say out.
There you go. Yes.
That's a cure for you right there, but you may not have any friends after that.
Yeah, that's right. But have fun. Be active, right? Don't let that stop you from doing pickleball. Just be smart about it.
We're all athletes. Jill, thank you so much for this. It's been very informative, and thank you for all the injections you do on me. And all these patients are very grateful. You're an amazing injector.
Thank you.
As well as person. So thank you all. Go play pickleball. It's a lot of fun. Enjoy. I'll see you next week.